Good evening, all. Yes, welcome to Rishi as well as IHDA. So today is the first day for our Patient Safety Awareness Week. We'll see what is the importance of patient safety culture. So why we need to give more importance for patient safety culture? What kind of relationship between patient safety culture and medication error, and how to promote patient safety culture. Before going to our first topic, let's see some important finding from AHRQ about patient safety culture. The research finding from AHRQ: improving the culture of safety within healthcare is an essential component of preventing or reducing errors and improving overall healthcare quality. If you want to prevent medical error, even if you want to reduce errors, which one is we need to focus first? Culture. Because as per literature, which one is the main cause for medical error? Organization factors. What are the contributing factors from organization, from our top management? Lack of commitment. There is no proper communication between top management and other stakeholders. There is no clear vision, mission. So these are all comes under organization factors. So if you want to reduce medical error, the first one is we need to build a positive culture. But who is the one responsible for culture? Top management. If there is clear communication from our top management, if they are aware the importance of culture, definitely we can able to build positive culture. This is the recommendation from AHRQ. As per the current scenario, what is the main challenge for culture? Blaming culture. Still we have blaming culture, and there is punishment for mistakes. There is no appreciation and too much of burnout. As per this research finding, what they concluded, nurses have consistently complained of the lack of blame-free environment. Also, there is no clear commitment from organization regarding culture of safety. Even for culture, we need to focus on teamwork and communication. So as per this, if you want to build a positive culture, try to assess the communication between provider and receiver. Is there any gap between our patients and physicians, between the patients and nurses? As well as we need to know, is there any problem in the teamwork? So if we focus on all the things, probably we can able to build a positive culture. So if there is positive culture, definitely we can able to get support from our employees. We can collect more data And if there is data, we can able to identify the root cause. And if you know the root cause, definitely we can able to improve our process. So this is the recommendation from AHRQ. So this is the message for our today's session. So today we have Dr. Jaichandran. He's a consultant at Sankara Nethralaya. He's also a director of patient safety. Recently, he received CPPS certification from IHI. Also, he's doing a lot of research, not only in patient safety, even in clinical practice. So he's going to share his experience about culture, how to promote culture as a physician. As a consultant, what are things we can do to build a positive culture? Because still there is problem from our physician, especially for culture. Still there is no support from our physician. So today we'll see what are the contributing factors from our physicians, why still there is no support, there is no awareness about quality and patient safety from our physician group. So we'll see more features about promoting the culture from Dr. Jaichandran sir. Yes, sir, Dr. Jaichandran sir, over to you, sir.
Thank you, Dr. Tennarasu. So I will be sharing my presentation now.
Yeah, please go ahead, sir.
Hope you are able to see my slides now.
Yes, sir. Yes, sir.
Okay. Thank you. I kindly request all the participants to mute their audio, please. Other participants. So at the outset, I would like to thank Dr. Tennarasu, RISI and IHDA for organizing such a useful webinars continuously 5 days and promoting this patient safety culture. Thank you. So myself, as Dr. Tennarasu said, is a Deputy Director in Department of Anesthesiology and the Chairperson for Hospital Safety Committee at the reputed eye hospital, Sankara Nethralaya, one of the largest in India. So the topic which Dr. Tennarasu gave to me was how to promote a culture of safety in healthcare. So just a brief overview of my presentation. First, I will be discussing safety culture. Where do we stand now? What are the different types and definitions for safety culture? What are the barriers faced and how to overcome it? And what are the challenges that is faced in especially in a single super specialty hospital? And finally, anecdotally, I will be sharing how I overcame all these barriers. As you all know, the concept of patient safety has been derived from the aviation industry. A small bit of comparison here. So the aviation industry, despite the number of worldwide flight hours doubling over the past 20 years, you see that the number of fatalities have decreased from 450 to 250. Whereas in healthcare industry in USA alone, there are estimated 2 lakhs preventable medical deaths every year. This amounts to almost about 3 fatal airline crashes per day. Okay. So if that is the scenario, then airline industry would have been closed and no one will be allowed to fly until this problem is solved. What is the basic reason why there is a huge difference in adverse events happening in healthcare industry but not in aviation industry? There are many reasons, but I just wanted to quote you some 3 important facts. One is checklist. In aviation industry, the checklist is do and verification later. Whereas in healthcare industry, it is only read and verify. And in aviation industry, there are 3 forms of checklist. As you can see here, simple routine operations, for complex operations, for emergency procedures. Whereas in healthcare industry, most of the times we just fill it up only one type of checklist. Coming to the training part, in aviation industry, it is more rigorous, longer duration of training is given. Varieties of settings have been tried. They use simulator module also, and then they revalidate also the training. Also, they focus on non-technical skills like leadership qualities, team working, decision making, situational awareness, managing stress, coping with fatigue, etc. in pilot training. Whereas in healthcare industry, none of them is focused. The last and most importantly, incident reporting of adverse event happening. In aviation industry, it is strictly enforced, whereas in healthcare industry, lack of strict rules exists. Investigations in aviation industry is done thoroughly. Photographs taken, conclusions, recommendations are given, and it is often recorded in the black box. Whereas here in healthcare industry, there is no such proper investigations done, and it is not recorded. And in aviation industry, safety is equal for everyone on the plane who is traveling in that flight. Whereas here, the healthcare industry, it involves mainly one patient. So these are all some of the reasons which I would like to share with you, all the reasons why that adverse events are more frequently occurring in healthcare industry when compared to the aviation industry. So we should try to focus more on the training and also strict incident reporting. Having said that, what is the definition for safety culture? Weaver et al. Has clearly defined the culture of safety as an organization's shared perceptions, beliefs, values, and attitudes that combine to create a commitment to safety and an effort to minimize harm. In other words, it can be defined in a very simple manner. That safety culture is a combination of attitudes and behavior towards patient safety that are conveyed when a patient is walking into a healthcare facility. According to JC, the essential role of leadership, the three key elements for safety culture: fair and just culture, reporting culture, and learning culture. Now, according to a study that is published in Journal of Patient Safety 2016, an improved patient safety culture and teamwork helps the health system to reduce patient harm across the entire hospital system and multiple harm types. Based on the results from the safety attitudes questionnaire, as workforce attitudes towards safety improved, all hospital harm decreased significantly, as did serious safety events. I think this is what Dr. Tennarasu also quoted in the introductory statement, that whenever a hospital has an improved safety culture, definitely it is going, the hospital or the organization is going to have a reduced patient harm events occurring. Now, the organization that does not have give importance to safety culture, as you can see, they face the following adverse consequences like underreported safety events, lack of improvement, higher rate of harm, workforce burnout and turnover, and rising costs. So it is very important to have a safety culture in an organization. Now, this is an interesting organizational accidental model proposed by Vincent et al., where, as you can see, any incident happening that is due to an individual error or violation which penetrates through the lacunae that is present in any defense system, where this main unsafe acts is in turn, there are many contributory factors. As you can see, it can be due to work factors, team factors, individual factors, task and patient factors, which in turn is contributed by latent failures due to the management decisions and organizational process. So as you can see here, the incident is not mainly due to the individual errors and violations. It may due to the organization and culture factors, which is defined as latent failures. Now let us, this is a model that is proposed by Hudson safety culture model, where one can evaluate where their organization stands in a safety culture value. It varies from worst to best. That is, there is a 5-step progression from a pathological stage where there is no care culture and no system, that is called pathological, through to a generative stage here, high up in the ladder, where managing risk is a way of life and fully integrated systems are effectively in place. This is a 5-step actually. One can evaluate where the organization stands. This pathological is the worst, where the healthcare workers here, they never care. They who cares as long as we are not caught. Say they work like just like that. Whereas in reactive stage, here the safety is considered important. But what happens is that whenever an accident occurs, they tend to react. They tend to act some, they tend to take some safety measures. That is called reactive. Then calculative. It is in this stage where the organization have systems in place to manage all hazards happening. The next stage is proactive. Here they anticipate and then they take already steps is there. So they anticipate in this and then they work on the problems that they still find. Whereas in generative, here the patient safety is number one here. They live and breathe the culture of safety. Safety is their business around here. This is called generative. So this is actually a nice safety culture model that is proposed by Hudson ladder, where one can evaluate where the organization stands in terms of safety culture. Now, there are different types of patient safety. It can be a medical safety, surgical, electrical, laboratory, sanitation, infection control, blood safety, equipment installation safety, as well as environmental safety. Now, there is an entity called as patient safety. What is patient safety? This is absence of preventable harm occurring to a patient during the process of healthcare delivery. As you all know, to error is a human. Every error has a root cause and every cause has a solution. But remember, one unknowingly done error is a miss, but repeated error is unacceptable, and it is also sometimes punitive actions can be taken. Error can be prevented with everyone's initiative in the organization. Here comes the very important role of the patient safety. What are the principles of patient safety? 5 rights: right person, right drug, right dose given at the right route and right time. Now, coming to the international patient safety goals, we aim to improve the identification of patients, effective communication, and also improve the medication administered. Whereas we try to reduce the healthcare associated infection, falls occurring in an organization, and handover errors. Coming to the challenges that is being faced in an organization in the current scenario are: number one, errors and system failures. They keep occurring in an organization. Action on known risk is very slow. You know the risk happening in an organization, but still nothing, no action has been taken. But even if they take, it is very slow. And detection of systems, that is detection of any faults or any errors occurring in the system, is still in their infancy stage only. Understanding of the causes, that is root cause analysis for any errors, is still limited. Also, there is limited measurement of that impact or any evaluation steps taken. Blame culture is still alive in all organizations. Defensiveness, secrecy, everything is undercovered. Many events are not reported, and simply there is no effective communication in an organization. Having said that, what are the barriers to communication? One, it can be due to competition for time and attention. There are multiple levels of hierarchy. Healthcare worker doesn't know whom to report an error. So there are multiple levels of hierarchy occurring in an organization. Power, beliefs, values, and prejudice exist. Fear, lack of empathy. Now, how to overcome these barriers to communication? One should devote adequate time and attention to listening to any healthcare workers' complaints. Reduce the number of levels or links in the hierarchy. There should be one point of contact for any errors to be reported. It should be very user-friendly. Change the organizational philosophy to encourage free flow of communication. Communication should be more freely flowing and easy way manner. Use multiple options. Then always engage in empathy. That is very, very important. Now, what are the top 9 reasons that workers do not report near misses? That is under-reporting. First and foremost, as you all know, fear. That is whether they will be punished for any reasons or loss of job or etc. etc. Second, embarrassment, feeling humiliated. Okay. Then any difficulty in that process, that as I was mentioning, that it should be a single point of contact. So the reporting should be very easy. Bureaucracy, worker may have to do an extensive follow-up for reporting a simple error. Peer pressure, loss of reputation. It is easier not to. That is very simple. If workers think no one is bothered about, then what is the need for reporting it? Then lack of interest from the organization. When workers believe that management does not take it seriously, what is the need for me to reporting it? Naturally, that will be the intention for the healthcare workers. So the management should take it very seriously, perceived as pointless. Once again, if management thinks that near misses are not particularly important, then these are the reasons for the underreporting in an organization. Now, how to overcome these challenges? First and foremost, you should form a patient safety committee. If not existing in an organization, it should be formed. Then develop a clear policies and protocols for the patient safety committee. Discuss regularly what are the safety initiatives taken within the hospital staff. Keep discussing it regularly. Orientation program should be conducted in a regular manner. Reorientation can be done. And encourage transparency in any event. Non-punitive incident reporting is very, very important. Then each department has to devise their own patient safety protocols, because from one department to another department, safety protocols may vary. Then whenever an incident is reported, you investigate thoroughly and take remedial measures. Not only taking remedial measures is important, you review, monitor, and evaluate the safety procedures regularly. Okay, these are all some of the steps that can help to overcome these challenges. What are the very important points for an effective reporting system? Institution must have an supportive environment for an event reporting. Report should be received from a broad range of personnel. It is not important only the physicians are reporting. Almost at all levels of healthcare workers, they should report. Summaries of reported events should be disseminated in a timely fashion. That is, what is the action that has been taken has to be informed. Structured mechanism must be in place for reviewing reports and developing action plans. So the best incident reporting tool is the one that gets used and acted upon. Action is very important. If there is no action, none of the employees will be interested in incident reporting. Now, coming to the single versus multi-speciality hospital, as I was mentioning, I'm working in a single super specialty eye hospital. So this is some of the differences. As you can see here, in a single specialty, there is a domination of a single department. That is, it can be an eye, it can be an ENT related hospital, etc. Whereas here in multi-speciality, there is no discrimination between department, faculties, and team. And naturally, here the single team has more manpower, financial support, equipment is also more to them, facility, demand, decision making is there, hands and research activities is more being done, and development is progress is concentrated more on a single department. Whereas in a multi-speciality, all teams will be equally supported. But as you all know, the patient safety, teamwork is important. All the departments has to be involved at all levels of healthcare worker. So this is one of the very important challenge, especially in a single super specialty eye hospital. Now, how to overcome? Definitely, it is going to take longer time to establish a culture of safety, especially in a single super specialty hospital. We need to prove that culture of safety is important in an organization. How we are going to do? We need to perform research, survey. Okay, we need to assess and perform and show by evidence-based study that by promoting culture of safety, then there will be definitely a reduction in the harmful events occurring in an organization. Then frame protocols, follow it up strictly, implement it, and keep improving. So these are all some of the tips I could suggest. And coming to the last session, how I overcame all these barriers. It was actually a 20 long years journey for me to achieve this blame-free safety culture. Actually, the hospital safety committee in our hospital was launched a couple of years ago, and I am the chairperson for this safety committee, and we have a director of the vitreoretinal department as a co-chair. Then we have a medical and a non-medical safety officer and about 15 to 18 committee members from all the departments. We regularly meet once in a month every second Saturday, and if required, depending upon the issues, we form a subcommittee also. And as you can see from the photograph, we regularly meet at every month, second Saturday. The departments includes not only the admin people, security officers, IT people, BPS, biomedical engineering, pharmacy, IT, quality, nursing department, and almost and infection control, lab, etc., etc. The first and foremost, what I did was I streamlined this incident reporting. We got a single form wherein the healthcare workers can report both clinical as well as non-clinical events like clinical incident, drug-related, medical emergencies, anesthesia-related, fall, violence, security threat-related, needle stick injuries, equipment-related, work-related, fire, etc., etc. So all these events I streamlined and got a single incident reporting form, and I classified these incidents as no harm, near miss, adverse event, and sentinel event. Then I got a rapid response medical form, adverse drug reaction form, code blue form. I made this available easily in our portal where they can download this form very easily and they can submit it. Then, as soon as they assumed the chairperson role, I met all the departments in person and very clearly stated to them that incident reporting is blame-free culture. At the same time, accountability also should be there. As you can see the trend in our hospital, I assumed this role in 2020, at the end of 2020, I would say, you can see suddenly there was a spurt in this incident reporting occurring. This is the incident reported for the entire month. As you can see, it is gradually increasing. In the May and June, it is mainly due to that lockdown period. In January and February, we had that lockdown. It was very low in number. Otherwise, it is kept on increasing. Now, in each and every HSC meet, we discuss the total incident that has happened for that month. That includes both clinical and non-clinical events. And for major incidences, we find out the root cause analysis and corrective and preventive actions if taken. If there are enough or anything to be done, we discuss and try to implement it. Let me share you a simple example what occurred in our hospital. This is actually one of the first floor. As you can see, the huge corridor. So here is the lift actually. So when the patient comes here, as you can, they have to go to the right for the pharmacy and for the left, they have to go for the surgery fixing center. So they had a signage board near the lift. Unfortunately, what happened, the people who want to go to the pharmacy, they came to the surgery fixing center. And for the patients who are going to surgery fixing center were going to the pharmacy, vice versa, they were going. So the people from the surgery fixing center, they raised this as an incident where we found a simple solution to it. Instead of putting the signage just near the lift, we just hang it out here so that the patients who want to go to pharmacy can go this way and for surgery fixing center can go this way. Not only we did this, we did a 3-month evaluation study, just a simple survey with the help of the patient feedback. We came to know that it was very useful. So we measured this effective step that has been taken is useful or not. Then here are some of the photographs of the hospital safety rounds, which we do along with the maintenance team, security officers, nursing and quality team. And here we can see the certificates being awarded to all the employees who are reporting the near miss. As you can see, this gentleman is now none other than our president for the organization, who gives due importance to this. And he himself personally attends this meet, and here we can see that all the individual employees at all cadres, right from pharmacy to nursing to security people also. Here we can see the security people, each and every people, we give them the near miss certificate appreciation award, and then we mark a copy to the HR department also, so that it is considered during the appraisal is being done. And here are some of the group photographs, and it is also being done in Calcutta branches also. And here are some of the group photographs being shared. And last but not the least, we are going to celebrate the Hospital Safety Week celebration in the 30th in a very unique manner, where I got a support for the management to conduct an event called a corridor. That is where the employees will be walking in this corridor for a, we give them 10 minutes time, where they have to find out the safety related errors. So it can be due to, we mimic an admission counter, surgery fixing center, ward, IP, pharmacy, etc., etc. Within a 10 minutes time, the employee has to identify the maximum safety errors, and the winners will be awarded. And for the 31st, we are having an interesting safety wizard. That is a quiz for the hospital safety related gadgets. And on the 1st April, we have a huge function at our auditorium where the winners for these two events will be announced. Apart from this, there are nearly about 50 to 60 near miss, and we tend to identify and award 5 best catch winners. And we are also going to give certificate and championship for the best male and female 2021 and 22. Not only that, we have different branches and departments. So we will be announcing who is the best department and branch for that safety campaigner for the year 2021 and 22 by giving this rolling trophy. Last but not the least, also as a HSC safety committee, we also concerned about the safety and the health and safety of the employees also. So we are going to launch an e-newsletter under this following section, where the employees can share health related, yoga and mind relaxation, nutrition, diet, safety related. They can even share any success stories, interviews with cardiologists, etc., etc. This is mainly meant for the health and mind relaxation for the employees. So to conclude, safety should be part and parcel of everything, whatever we do. Whatever decisions we make, safety implication must be taken into account. Now, currently, what is the situation? Visible islands of excellence, that is, vast knowledge exists, but in a sea of invisible failures, that is, barriers, with risk lurking just below the waterline, that is, there is no safety. Remember, in a single super specialty hospital, this sea of invisible failures, that is, barriers, are more. It requires a lot of time and patience to widen those islands of excellence and to connect these islands with more dry land. Remember, safety begins with teamwork. Thank you all. Thank you, Dr. Thennarasu.
Thank you so much, sir. Yeah, it seems there is significant improvement after your CPBS certification. Am I correct, sir?
Definitely.
Yes. Excellent, sir. Even as per your practice, there is a just culture, there is rewarding culture, and even there is reporting culture. Yes. So thanks a lot for sharing your real scenario, sir.
Thank you very much. It's an honor to me.
Thank you, sir. So I have some questions regarding safety culture.
Yeah, tell me.
So, what is the level of support from your physician group, sir, for even for incident report, for other initiative regarding safety culture, or even for quality? So, what is the level of support from your physician? Like even the number of incident report. So, what is the percentage of incident reporting from your physician group?
Yeah. So as you are mentioning rightly, it is mainly the nursing team and the DPS staff who are incident reporting, and some of the doctors, especially the postgraduates, are reporting. Some of the consultants have started reporting now, especially that mistaken identity. They do report. And what I do is I personally meet all these physicians Maintaining rapport with the physicians is very, very important. They should not feel that what is the big deal in it. After all, we are been practicing for this so long. Now, what is suddenly safety comes in? Why? So it is high time that we all meet him in personally and try to say to them clearly that what is that happening, what was happening so far. So by this way, I try to involve physicians. So I try to meet them personally, and maintaining rapport is very, very important, especially with physicians. As you have rightly mentioned, most of the incidents are right now are reported by the nursing team, followed by the pharmacy people, and then followed by the DPS. Security people have also been started to report. It's a very good sign. And last comes some of the doctors. Recently, for the past couple of months, some of the doctors have reported, especially the mistaken identity. And one more important thing is that after this incident meeting, I tend to give them the feedback. I tend to give them some personal mail thanking them for incident reporting. That is most important. We have to give them the proper feedback, what has been done, because they should not believe that what happened then finally. So I tend to give them the proper feedback, and I thank them. And we tend to spread this in our departmental meeting also. What is the importance? So thereby we tend to create some awareness. Hopefully by this celebrations and functions, I think more of physicians also will be involved in this.
Will get more support from your physician.
Yeah.
And what about your top management, sir?
As I was mentioning in my slides, my management was they keep supporting for each and every step, whatever it takes. Okay, so this concept of near miss, I never met anyone. I just mailed my president. You will not believe, within the next 10th minute, I got a reply from our president saying that it's an excellent idea. Please go ahead. So this sort of support, I think, only from this support of the management we will be able to do, and they encourage this. That is the most important. As I was sharing in my photographs, our president himself make sure that he attends this meet and he hands over the certificate. It's a great source of encouragement for the lower grade employees especially.
Excellent, sir. So is there any resource allocation especially for patient safety from your top management?
I think there is an allocation, for example, for conducting this near miss and for campaigning, for doing this thing. They allocated budget also. Hopefully from next year onwards, officially, they will be able to allot a considerable amount of funds for our committee also.
Excellent. Thank you, sir. Thanks a lot.
Thank you very much.
Any questions from others, please?
Sir, may I ask one question?
Excuse me.
Yeah, please.
Can I ask a small
Yes, sir.
clarification?
Yes, sir. Ashok, sir. Yes, please go ahead.
Yeah, actually, in one single specialty hospital, as the doctor was mentioning, because the processes are almost same, because there's not much of a variation. It's a single specialty. I found in one hospital, I can't name it, a single specialty hospital. Again, it's an eye hospital only. I found a lot of many people are, very young, and maybe they are not even fully trained as to know what are the consequences of this improper incidents reporting and not reporting at all, or the very concept of incidents reporting or near miss reporting itself is lacking with them. I felt personally, maybe there is an unawareness among them that they don't know what could be the consequence of certain things they are doing. So how you could overcome in a a single specialty hospital, where probably they may even have a kind of a training center where they may be just training those people in those field, and then just putting them onto the job straight away without proper training. Whether this is causing a kind of a unsafe practices particularly in single specialty hospitals, where the processes are almost the same, because the day in day out they're doing the same thing. So maybe they're not so much bothered about keeping a trained person, where there could be some variation and all that.
Yeah, definitely. Then a single super specialty hospital, as I was mentioning in my slides, only one department. Say, for example, for us, it is mainly the ophthalmologist who will be given a
Correct, sir.
due recognition and due this thing. So it is very difficult, especially we as an anesthetist and other departmental people, for that matter, general physicians are also there, lab doctors are also there. So it is, as you are rightly mentioning, they will be more focused on their department, their faculties only. So
Yeah.
fortunately for me, myself being an anesthetist, and I was able to give clear this CPPS certification, and I did lot of research. They recognized me, so I realized the importance of this non-ophthalmological areas also. So right now, what is that I do is that I give training, as I'm also an ALS BLS trainer. So I give training for all doctors and for new joinees, BLS and ACLS class also in a unique and interesting manner with the help of mannequin. And I regularly do them in every 6 months. So that is also important. I give them the
Yes, I
BLS.
feel that's very, very important, sir. Particularly the attending staff,
So
it's very, very important.
coincidentally, I am also a BLS ACLS trainer. So I bring a special mannequin and a unique and interesting manner. I keep them engaged, and we do regularly mock drills also. That is more important. Mock drills, and we try to find out what are the barriers in it for performing those mock drills. So that is more important. As you are mentioning,
Excellent.
if a single specialty in only one department is given a hand, then as you are mentioning, it will go down only. Fortunately for me, they recognized me. So I was able to realize the importance of non-ophthalmological side, and I am trying to cover it up.
Yes, nice, sir. Very nice. Thank you.
Thank you. Thank you.
Thank you.
Sir,
Thank you,
may
sir.
I ask a question, sir?
Yes, sir. Yes, sir.
Sir, I'm Dr. Jaichandran. I'm from Delhi only. I am also an eye surgeon practicing in Delhi.
Oh, good afternoon, sir.
And I once visited Shankar Nethralaya also for assessment in NABH also.
Oh, okay.
Sir, I want to really appreciate you have presented very nicely for the development of the safety culture, which is very essential for quality improvement of the hospitals. I really appreciate this. It was very good.
Thank you, sir.
I just wanted to add two more things. Number one, this appreciation of those who report the cases of infection or other problems to the organization is appreciated for the workers who are working in the hospital. If it is given to the persons who are not working in the hospital also, like the attendants of a patient or other persons or social workers who are not a part of the staff of the hospital, if they also report, for example, one day some person saw a nail lying on the parking area. Because this nail will pierce through the wheels of a car, and it may get ruptured, and it may get great problems. So that person reported that nails were there in the parking area. If this is taken care of, if this is appreciated, other people will also help to improve the safety of the patients over there. This will be useful. Number one. Number two, I want to say regarding the reporting of the cases. I have seen in eye cases, we report the cases of after the cataract surgery or after the retinal surgery, only those cases which have developed endophthalmitis or other unbearable loss to the eye. But if cases of simple cases like conjunctivitis or poor healing or other things like simple corneal case of corneal ulcer which is not healing properly, what is the cause, what is the root cause of this? If we keep improving this case, those persons who report such cases where the delivery was delayed, this will also help in the improvement of the quality. These 2 points I just wanted to add to this. But I really appreciate it was a very nice presentation. This will be useful. And I feel this development of the safety culture is a need of the hour for development of quality. I really appreciate it.
Thank you. Thank you.
Any other question from others? Yes, Dr. Afan, sir. Any question?
Good evening, sir. Good evening.
Good evening.
Sir. I just joined this. Sir, I just want to know from the sir that what is the best strategy we can implement in the hospital to involve the clinicians in all this quality and a patient safety kind of a work, which we are doing, because it was very difficult to involve the clinicians in our system to develop a quality program or a safety program. So can we get a suggestion that, sir, how can we get to involve the clinicians in our hospitals?
It is very difficult only, as I was mentioning. It all depends upon how we approach them. How we approach them, that is important. We should do some survey study. We should do some evidence-based study, so that just like that, you can't go and say that safety culture improves that or reduces the harmful events happening. We should do basically some survey or research or some basic statistical studies and evidence-based. You can approach the head of the department of each organization and try to impress upon them. Then you try to meet there in the departmental meeting all the clinicians, and you show your presentation, and then you can try to gradually rope in that support. As you were mentioning, it is very difficult, but luckily, since as I was mentioning again, maintaining a good rapport and how we approach them is very important. Fortunately, I was able to achieve it, and I am still able to do it.
Sir, thank you, sir. And I am working in a hospital where I think I can say that 70% of the doctors are visiting based, and it was very difficult for me to get involved, because I don't know how to approach these visiting doctors, because it's very difficult for me, because I can't able to find a way.
Dr. Afan sir, the problem is very simple. If there is commitment from your top management, if there is clear communication from your top management to physician, probably we can able to get support from our physician. This is also more important. So the communication from your top management. Is there any proper communication from your top management to physician regarding safety culture, regarding quality?
Yes, sir, they are doing that. But for a visiting consultant, it's very difficult to get them.
Visiting consultant, as you are mentioning, is very difficult, because each one of them have their own style of practice. And for first and foremost, it should be standardized. Then only you will be able to know whether we are deviating from the routine, this thing. But in a visiting consultation hospital, you will not be able to standardize things. Unfortunately, that is going to be one big hurdle for you. I do agree. Until otherwise you standardize things, you will not be able to get in the safety culture reported.
Yes, sir. Thank you, sir. Thank you, sir.
No, thank you. Thank you.
Any other question from others, please? Good.
So I would like to thank Dr. Tennarasu. It is all because of this I was able to clear that CPPS. From there only I got this encouragement and ideas to all this, and I was able to achieve this milestone. Thank you, Dr. Tennarasu, once again.
Thank you so much,
from the bottom
sir.
of my heart. Thank you.
Thank you, sir. Thank you all.